Hi, my name is Dr. Steve Miners of Rehab Effects in Austin, Texas, and today we're going to discuss Eyelights. Eyelights is the invention of Dr. Peter Gillette, a chiropractic neurologist in the Dallas area. And he invented these back in the early to mid-90s, 1990s. And what he found was that by getting both sides of the brain, right and left brain, to work better together, that was able to improve function. And that function could apply to swimmers such as Lars Frolander, an Olympic swimmer back in the 1990s who attended SMU, Southern Methodist University. And what they found was by using the Eyelights that he was able to jump in the water faster once the gun went off, and he was already pretty fast in the water, but getting him from the board into the water was what made all the difference for him. And that's where the Eyelights came in. The indication for these is whenever we want to, again, balance the right and left brain. So that could be with little children who may suffer or suspected of them suffering from ADD, ADHD, children with neurosensory disorders where they're showing maybe they're not performing as well as they could in school, for people who suffer from headaches, migraine headaches, or someone who really just wants to perform their sport of choice better. Eyelights, they look like this. The lens can change depending on what's best for the patient. And what you do is when you turn that on, you see little lights blinking every few seconds. What you have to do is you determine which side of the brain is weakest, and then you either have the Eyelights shining on the left side or on the right side. By doing that, you're stimulating that part of the brain that is weakest, and you're trying to, what we would call, up-regulate it so that the right and left brain are working better together for improved performance. The patient then puts them on, which we will see in the next segment, and they wear them for a period of time, sometimes either performing their sport of choice or the activity, or wearing them for a period of time and just relaxing. At that point, they then take them off, and then you can determine some improvement.